All right, Doc, you there? Hello. Hey, how you doing?
Yeah, hanging in there.
Okay. All right. So, all right,
So
let's talk a little
share
bit.
my screen. I'll share my screen.
Okay. Now, before you do that, yeah, go ahead and share your screen, and then I want to kind of hear about the different emotions that you're feeling right now, because I mean that's pretty close. You go from a 73, so 2 points, literally 2 points. So I don't know if it feels better or worse that you get close to the goal line and not make it, or does it feel worse if you so far away and you're like, okay, I have no chance anyway?
Yeah, I mean, if I had like you said a 68,
Right.
actually I would say that sure I would feel devastated, but then I realized that hey, I guess I got to work harder. But 73,
Right.
it's just frustrating. It's just so frustrating that you're you're right there, but you didn't get it.
Yeah. Yep. 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 You used the perfect word. You said frustrating. That's the exact word. So yeah, I get that. I totally, totally get it. So go ahead and share your screen with me so I can see
Okay.
kind of what you have.
Okay. So.
How did you feel on the test day?
I felt, obviously, of course, I felt nervous on the first day,
Uh huh.
and then the second day, I felt confident.
Gotcha. So the first day, anytime, so you had a little nerve. So the nerves were the issue, right?
Hmm.
Okay, gotcha. Okay.
And I felt, and also on the third part of the exam,
Uh
the third part of day one,
huh.
um, it felt hard.
Okay. 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 Gotcha. All right, perfect. Okay, so if you could, if I don't know if you can make your screen a little bit bigger so I can see this, because I can see where it
Oh
says that
yes.
I can see INBDE summary. Okay, there we go. Yep.
Oh,
No, that's smaller.
hold on.
Yeah. Nope. You go another way. Let's see. Okay, right.
Is it better?
Yeah, that's okay. That's good right there. Okay. So one. So when I'm looking at this right here, one, I'm looking at the national average. And then I'm looking at where
Hmm.
you performed at compared to the national average. Now you know how to read this, right?
I think so.
Okay.
Oh, you want me to go up?
No, no, no,
So
no.
this is
Yeah, yeah. So there we go. Go to that one right there. So you can
okay.
now you see that you see where it says the pass mark,
Yes.
and you see where your score is.
Uh-huh.
Now imagine I have seen people where your score is. I have seen people well behind that score before, a lot way back there. And it's like if you look at that pass line, it almost looks like okay, that's the finish line, right? And it's like you're right
Yes.
there. Now, the other thing we got to look at here, though, is the national average. Okay, because
Mm,
let me tell you why I say look at the national average. Depending on when you take
yes.
your exam, right? There are optimal times to take your INBDE exam. And when I say optimal,
Mhm.
if you take your exam when a lot of, say, U.S. dental students are taking their exam, right? The national average
Mhm.
is going to be higher. Okay.
Oh.
If you take it kind of like off, what I call off season, or when a lot of students are not taking their exam, then the national average is going to be lower. So let me just say this: when you took your exam, right? You took your exam in September, right? So
Yes.
that is kind of like in the middle. You have students who take it, but the worst times to take, like, in terms of taking the exam, say during the summer, you don't want to take it during the summer.
Mhm.
And because a lot of students are taking that exam during that period of time, you want to really stay away
Okay.
from like December, so to speak. But anything
Okay.
from like January to April, January to April, fine. Anywhere from October to December, fine. Okay. But
Okay.
when you hit the summer months, you can expect that national average is going to be a little bit higher. Now,
Okay.
you could have taken your same thing, right? Now, keep in mind, I still think, when we talked, when you were doing the classes, I still told you, I felt like you needed more time with content. You needed more time for us to go through material. And I told you, I thought, if you had at least, I don't say, like, I can guarantee you, if you'd had at least another month with us, we would not be talking right now.
Mm-hmm.
This would not be a conversation. And that's what I advised you in the beginning, right? So let me ask you this. Let's go back. Let's say we're looking back because we got to know the mistakes of the past to correct the future, right? What would you have done different now? Looking back on how close you came.
I would have focused more on content.
Okay. Yes. Yeah.
Because obviously there's a lot of content, and I thought I had a lot of stock knowledge on content based on what I studied, but I guess I needed to practice it some more.
Yes, I agree with that. I agree. You definitely need to practice. But the other thing too is, when we were doing questions, you would rationalize things out and you might get it right, but you might get it right for the wrong reason. And so if you do that, that's not really helping you. So that's why, I said you could study, you could get a book, you could go through content, you could do practice questions, but you actually need somebody to say, hey, no, that's the way you look at it. Or, yeah, you're on the right track. But bottom line is, here's the good news. The good news is you're going to pass this exam. Okay? You are going to pass. Do you know that?
Yeah, I believe so.
See, that's just that don't sound confident to me. That doesn't sound like.
Oh no.
That doesn't sound like a dentist that believes that. Do you actually believe? I want you to think for a second. Do you actually believe you're going to pass? Can you see a passing score in your future?
I do.
You do. Okay, good. So you can see you opening up that email, and that email says pass. Okay, perfect. That's good. Now scroll down a little bit. Now let me just tell you something. As we look at this right now, this score report, you and I will never look at this score report again, because I don't want you to ever think about it again after today. As a matter of fact, when we get off this call right now, I want you to get rid of this score report. I don't want you to ever open this email again. I don't want you to ever think about this score again. The only thing that I want you to focus on is passing. Got it?
Yes.
All right. So go down and we're going to go through this and look at it. Okay. So let's look at what you did well. Okay. So when you look at the national average, which are the gray boxes, right? So the gray boxes are the beginning of the gray box is the national average. Okay, you got that? Now, if you look at you did the best in what area?
Behavioral sciences, ethics, and jurisprudence.
Yeah, you did. Yep, look at it. You right there close to the national average. You see that? What was your second one?
My second one was pharmacology. Wow.
Look at you. I know you're surprised by that, huh? But we spent a lot of time on pharm, didn't we?
Yes, we did.
So we made sure that you look at how close you are to the national average on pharm, okay? So those are your two highest, right? The behavioral and the pharmacology. Now let's look at what's the lowest.
Research methodology and analysis and informatics tools.
Yep. And then what are the next two? Those next two.
Next two, biology of microorganisms and physiology and pathology. That's the basic ones.
Yep.
And then the third one, actually, I think it's both
basic.
Biology and then the sciences.
Yeah. So if you look at that, the two that you have the lowest in are the basic science areas. Now now if you go back and you think about your INBDE exam, do you remember even seeing any basic science on there?
Not much.
Yeah. Do you remember seeing any? Like, do you remember seeing anything that's related to?
I have. Okay. I have seen it.
So I've
seen microorganisms.
Yeah.
And also I've seen
anything with
some chemistry.
Some what? Chemistry?
A little bit of chemistry. A little bit of chemistry.
Okay.
The characteristics. Yeah, that category.
Which one? What did you see?
The physics and chemistry to explain the characteristics and use of technologies and materials.
Yes. Okay. Did you see anything with physiology, like systems, like endocrine, cardiovascular,
I
respiratory.
have.
All right. So what that is saying is that those areas, those are areas that you could have improved on, because you probably didn't focus on that a lot because that's not like super high yield. But let's think of it like this: had you focused a little bit more on that, that would have bumped those scores up, right?
Yes.
Bumping those scores up would have probably pushed you over to 75. Okay. Everything else, you were pretty consistent in terms of how you performed. You see that when you're looking at like the genetics and all of that. And then if you go down and you look at the practice of what's the one at the bottom? Practice and
profession.
Yes, right. Practice and profession, and then oral health management. So you're talking about like patient management, and there are probably a lot of patient management questions on the test, right?
There were.
Yeah. So patient management was another one, and then diagnosis, trauma, and learning. So I have an idea of what I think you should do, but the first thing I want to do is hear what you think. I want to hear how you would approach if you were advising you. How would you advance forward? What would you do to pass this exam?
So I would focus on the ones that my weak points.
Okay. Well, tell me how you would approach that. What would you be doing?
Yeah, I'd be brushing up on it, like content wise.
Tell me how.
So I'd read all the content material that I had, and then answer questions. I'm sorry. I'll be right back, Doc.
Yeah, no problem.
Sorry about that.
No problem. All right.
Yeah, so I'd focus on what I did wrong.
Okay.
If I do recognize the questions, I'd look at it, see what I did wrong.
Mm-hmm. Okay.
Try to understand it.
Okay.
Understand the question.
Okay.
And then I'll practice on it.
Okay, gotcha. All right. So that's what you would do, right? Now, let me tell you what I would do if I were you. What I would do is I would create an approach. Do you have something to write this down? Or
yes,
you could write it or type it or something, some kind of way for you to remember what I'm about to tell you.
Okay, I'll type it down.
Okay. All right. So, and this is based on, I can tell you, at least 15 years of seeing others who have, come up short. And this has been, good for them. The very first thing that you're going to do is everything that you remember from, and if you haven't done it already, do it. You take one day and try to just brain dump. I call it brain dumping, okay? You're going to write down
brain dumping.
Brain dumping. It's everything you remember from the exam. It could be just a detail. It could be a question. It doesn't matter what it is, but put it all on paper. And the best way to do that is if you have like let's just say the Mosby book, right? Or some type of other content material. Start flipping through the material, right? As you start flipping through the material, you're going to be like, oh, yeah, that was on my exam. Oh, yeah, that was on my exam. You take one day and brain dump, okay?
Okay.
So what you do by doing that is you create this template of everything pretty much that was on your exam, okay? Because you're going to remember a lot of things once you see it. Then you're going to see, hey, there's some things that I didn't know that. Oh, yep, I got that one wrong. Oh, yep, I got that one right, okay? So your first thing is you're going to brain dump. Now, once you brain dump, that's going to give you this high yield list, okay? Now, what you can do is you can always try to look at that high yield list as a teaching method. So you remember how when you would be with me and I said, okay, how did I know? What was my reason? What did I say? How do I know if you know something? What did I tell you? What is my rule?
Teach it.
You can teach it, right? So what you would do is from that brain dump list that you have, you would basically refine that list even more. And from that list, what you'll do is, let's give you an example. Let's say all you do is you remember there was a question and the answer was talking about fluconazole. Okay.
Mm-hmm.
And you don't quite remember the question, but you remember like the answers were fluconazole. It sounded like it was like an antifungal question, right? Or they may even talked about athlete's foot or something, right? So
Yes.
you would just write athlete's foot. From that right there, from athlete's foot, you would create a teaching, something that you could teach. You could probably say, okay, athlete's foot, better known as some type of, say, trichophyton. This is how you identify it. These are the possible treatments for it. And you would just create that. Okay. So now you can teach somebody about that particular question that was on your exam. Do you understand what I mean?
Yes.
Now, by doing that, you are teaching yourself. You're teaching yourself how to remember that. Okay. That's the first thing. So you're going to brain dump. Then you're going to develop the teaching tools based on the questions that you had on your test. Okay.
Yes.
Okay. Now, once you've done that, then you're going to have to go into what we call just content review. Content review basically means all the material that you learned, throughout your study while you were studying. So whatever that was, whether you were looking at videos or whatever, you're going to spend. Now, you are not going to spend 3 months going through that. Okay. You hear me? You're going to get you basically a bucket of popcorn and you're going to treat it like you're at the movies. Because you've already seen it, right?
Uh-huh.
So it's not like you're sitting there and you write notes on it because you've already done that. What you're doing is you're going to sit back and you're just going to look and say, okay, I am listening for something that I don't know. Because because obviously you know something. So now what you're doing is you're listening for what you don't know. So when you listen to a video now, when you look at that video, your brain is just to say, oh, I didn't know that. I didn't know that. Anytime your brain says, I didn't know that, you write it down. Now, hear what I'm saying closely. Write it down. Don't be lazy. Take a pen and paper.
Write it down.
Write it down. Don't type it down. Write it down. Because writing it will commit it to the brain, commit it to memory much better. Okay?
Yes.
Now, my recommendation is that you write it down on note cards. Note cards are easy. If you say are, traveling or flying or doing something like that, you can just pull out your note cards and flip through your note cards. Okay. So I would write down anything that you see in the video that you didn't know, write it down and write it down in a way that you can teach it. Okay. Now, give me an example. Let's say we're talking about patient management, right? If you're doing patient management and you're looking at the videos, then you create different scenarios where patient management would be needed. So if you're looking through a video and they say, okay, this patient came in, they describe this patient and what they need is, say, a root canal, and they give you some other, things that are going on with the clinical history. You write this down, write a brief synopsis, maybe 1 or 2 lines, and then you give how you would manage the patient. So let me tell you this. You're going to want to create at least 50, hear me closely, 50 patient management cards of your own. That means 50 patient management with different scenarios. Okay, you got it?
50 cases.
50 cases. And let me tell you, when I say the cases, you don't have to be, too extensive. Kind of just something where you would know, okay, here were the x-ray findings. Here were the clinical presentation. These are, and if it's something that's related to meds, then you can put the meds on there. If it's something related to pathology, you can put the pathology in there. But create it at least 50. Now, that's going to help you to see, hey, am I really creating questions that are like the ones I saw on my INBDE exam? Does it make sense? Okay, you got that. Now, that's going to, all of that, what I just described to you, is going to help you build your content. That's going to make your content stronger. Okay? Now, after the content is built, now you have to test the content. All right? So you build it and then you test it. All right? Now, you test it with question banks. Now, I think last time you did boot camp and you had mastery, right?
Yes.
Okay. Now, I would always say stick to what you've had because you're familiar with it, but you're going to review it a different way. Now, here's where, again, and I'm going to tell you, you got to have somebody going through questions with you. Once you've done the content, once you have that, you need to have somebody saying, oh, yeah, okay, that's right. You're approaching it the right way. That's where we would come in. So this is when you would say, okay, all right, Dr. Sutton, I'm ready to go through questions because I've built my content. Now, you don't want, of course, we can help you through the process of going through content and everything, but you can read on your own. I know you're strong enough, obviously, you've shown me that you're strong enough for that. But you need us when it comes to going through questions. Okay? Now, once you've built the content, you've tested the content, what do you think is next?
Build it.
Test
it.
Yep. What do you think comes after that?
Teach it.
Oh, well, I tell you, I think I might have to put you on my taxes because you sounding just like me now. That's right. So you build it, you test it, and then you teach it. So basically what would happen is after you've done all that and you're ready to teach it, we would just get a random day and you would get random topics and you would get random dentist in our program to let you teach it. So it might be patient management. You may just give them an hour presentation on patient management. How to approach it. And you would do that for all the topics. All right. You build it. You what? You test it. You what?
And then teach it.
And then you take it.
And then teach it.
And then at the end is what? You take it. You understand that?
And then take it, yes.
Yeah.
Yes.
Yep, that's right. And then the final thing is the P. You pass it. Okay?
Yes.
All right, so I want to tell me again, what are those 5 things?
You build it.
Yep.
You test it.
Yep.
You teach it.
Yep.
You take it.
Yep.
You pass it.
Oh, doesn't that sound good? Doesn't that sound like a winning plan?
Yep.
Doc, let me tell you. Doctor, let me tell you. You are going to pass it. All right? When I say this, doctor, you are going to pass the exam. So I don't want you to feel down because let me tell you something. I have seen, I can't tell you, I would say I'm almost in the thousands now, but I've seen hundreds of dentists who've come up short. And I can tell you this, everybody who has listened to exactly what I told them to do has passed it. They have come back and they've passed it. You got to stick to what I tell you. You can't fight me on it, okay? If I say do it this way, just trust me on it. And I would rather you trust me and do it exactly like I say. And if it didn't work, then blame me. But you got to do it exactly like I say, okay? Now, when you get ready to build it, you're probably going to need some guidance on exactly what I mean by building. Now, you may want to, I'll let you create something, you build it, you submit it to me, and I'll let you know you're on the right track. That's what you need to be doing. Okay?
Okay.
So whenever you're building it, you just let me know. So here's the thing. So you got to wait. I think it's a 3-month period. Well, no, okay. I think it may be lower now. I think they reduced it to 60 days.
60 days?
Yeah, it used to be you couldn't take the test again for 90 days from the time you took it. But I think I'm not sure, but it might be. I think they may have reduced it to 60, but it's either 60 or 90, 2 or 3 months. Okay. So that means you would be eligible to take the exam again, and you take September, October, November. So you'd be actually eligible to take it at the beginning of December. The beginning is definitely better than toward the end. If it's 60 days, you can take it in November. So the first thing would be to find out when. Now, here's the other thing. I would not wait. I would not. If I were you, you got to keep this energy going, keep the momentum going, because you know so much.
Yeah.
One thing I've seen that hurts people is that they take, like, they'll say, okay, well, I'm gonna study like for 6 months or 7 months, and then believe it or not, they score lower. They go lower when they do that. Those who those who just kind of go after it and say, okay, I'm gonna take mine in 60 days. I'm gonna go aggressive. I got 2 months. Let me go after it, and I'm gonna take it. I would recommend that for you.
Okay.
Okay.
So, because the good thing is, I still kept some of that knowledge.
Yes, it's all there, Doc. Everything that you learn is in your brain. It doesn't just get there and say, oh, well, I'm going to stay here for a second and leave. Your brain cells hold on to it.
Yeah, and also when I came back to work, I really understood what my mom was talking about to the patients.
See, that's what I'm talking about. See, that's what I am talking about. Yep. Look, I believe in you. I do. I told you this when we first started working, that I believe in you. The only thing that I would want you to do is just to listen to me. I know you were so eager to take the test, when you're going to take the test, but I just said, if he will listen to me, he'll do just fine. I know this. So, so hopefully this was, something that you can build on, and now you're motivated to say, hey, you got me by 2 points this time, but that won't happen again. Right? All right. So when do you plan to start studying?
So I'll just get over my I'll just have to process what transpired. It might take me like 24 hours to 48 hours.
I like that. Okay. Yeah, I'm fair. That's fair.
And if I'm emotionally ready, then I'll take it.
Whoa. What was the first question I asked you?
Oh, yeah.
What was the first question?
What
was the first question I asked you? I said I asked everybody who's in this situation. What's the first thing I asked you? Are you ready to quit?
Am I ready to quit? No.
Right. You just said something to me that sounded like quit, and I don't like that. You said that you're going to take 24 to 48 hours. I'm okay with that. Yes. Then you said, if I'm emotionally ready.
I meant to say, not if, when I'm ready.
See, okay, I'm still, okay. All right, so let me just tell you like this. Whatever you're feeling, when you told me you felt frustrated, I like that. Frustration is a good motivator. It's a good thing to push you. When you use the words depressed, I don't like that. Depression basically keeps you down, right? Frustration fuels your energy. So think of it this way. Depression starts with the letter D, and it's going to do what? Keep you down. Frustration starts with the letter F, and it's going to fuel your passion and your motivation to go forward. So frustration for F means forward.
Is fuel.
Fuel to do what? To go forward. Depression does what?
Brings you down.
There you go. So let me just tell you, hey, I'm going to just be real. Shake it off. Okay?
Yes.
Shake it off and think about what it's going to be like when you pass. Don't think about what it's like based on this score, because you're not going to look at this screen again, right?
Yes.
So I want you to think about passing this exam. I want you to fuel. I want you to be frustrated. I want you to be like, dang, I was right there. I want that. But I want you to use it as your fuel to move forward. And just do it.
Yes.
What does Nike say? Just do it.
Just do it.
Just do it. Don't, look here. Just do it, and here's it. Don't try to bite off a lot at one time. That's why I said you really need, like this. I'm working with a doctor now, and they haven't taken the test yet, and they wanted to take their test last month. But they said no. I told them they weren't ready. So I've been mentoring them like step by step, even like, in the building process, I told you build and then you test. So we've been going through like this mentor. We meet once a week for this mentoring program, right? And in this program, we do updates. Okay, this is where you are this week. Okay, good. You're on track. She'll, sometimes she'll tell me, oh, Dr. Sutton, this was a lot this week. I felt a little overwhelmed. Then I'll tell her, okay, let's tailor it back. Let's tone back a little bit. This is what I want you to cover for this week. So I'm able to work with her and keep her on track. You know what I mean?
Yes.
I don't know if that's something that, well, let me say this. I know that would help you for sure, because sometimes you can try to take on too much, and then you'll take on too much, and then you get overwhelmed. And then when you get overwhelmed, you're like, dang, I don't feel like doing nothing now. Because I've been with you. I know. You know what I mean? So you really need that weekly guidance, monitoring. You need that. And that right there will keep you on track. So, all right. So what I'm going to do, this is what I'm going to tell you to do. I'm not giving you 48 hours. I'm going to give you 24 hours to just enjoy life. Enjoy life the way you want to. You can enjoy it by processing. You could say, okay, hey, you know what? I just enjoy this because I might just sit down and just start brain dumping. I don't have nothing else to do. I might just start brain dumping it on the paper. Believe it or not, that's going to pull you out of any kind of depression if you were depressed, because we're not going to even claim depression. That is not something that we're going to say. Matter of fact, that word would never come out of our mouth again. So you're going to brain dump just to help you energize you moving forward. And think about it. It's going to be fun because you get to try to remember the stuff that you saw, right? So so you got 24 hours to relax, watch a movie, eat some popcorn, do whatever you want to do, right? And today is Wednesday. By Friday, I expect a call from you. And that call is for us to discuss how we're going to be moving forward. Because you already know the plan, but it's basically to discuss the logistics of that. You got it?
Yes.
All right. Any questions?
I don't have any questions, but I guess I have to reword that, because there are times that I say things, but I really don't mean it.
Yeah.
But yeah.
I'm telling you.
But yeah, so.
And let me tell you this. I'm proud. You may not feel proud of yourself right now, but I'm proud of you. And let me tell you, I'm proud of you because I've seen where you've come from. I saw you when you first started. I did. And I got to tell you, when you first started, I was like, man, I am super worried. And then as I kept seeing you, and I told you this while you were going through the sessions, I'm like, okay, I see improvement. There were some days I would get on you, right? But then there was other days, but then there were other days I'm like, okay, now he's getting it. And I'm hoping that you don't mistake that when you look at this, yes, I'm being tough on you, but I'm being tough on you because I know your potential. And when you get to that passing and you get that passing score, you're going to say, I'm glad Dr. Sutton was tough on me. Okay? All right. So that is the plan. That's what we're going to do moving forward. And I want you to be happy. I want you to smile because you know that you're about to pass this exam.
Yeah. So I think the frustration's gone now, but
no. Keep that. Look,
the frustration will still be there.
Yes, keep it.
I still have the frustration.
There you go.
It's just that I need to feed off of it.
There you go. Ooh, you threw another F in there. Man, look at you. You say feed on that frustration to fuel moving forward. Ooh, wait a minute. I think we just came up with something, Doc. You're going to feed on that frustration to fuel you going forward. Let's do it. You ready? You ready?
Yes, Doc.
All right. That's what I'm talking about. All right. So go ahead, chill out, relax, whatever. And let me just tell you this. Do not talk about this to anybody. Don't go sharing it with friends. Don't go sharing it. I mean, of course, the one close to you, I mean, I guess your mom would know or whatever, but don't give negative energy to any of this. So that's why I said, if you start telling a lot of folks about it, they're going to be saying different things. You don't need to hear all that. All you need to hear is what you need to do to pass. Okay. Mm-hmm. So keep this under your belt. All right. Keep this to yourself. You can share with me. Of course, you can share with your mom, whatever. But even when you share with anybody, if it's anything that's said negative, don't think about it. Get away from it. Or just say, hey, you know what? Guess what? I'm about to pass this exam, though. I want you to be so confident that even if they don't want to believe you, they got to believe you. You know what I mean?
Mm-hmm.
Okay?
Yes.
All right. So I will be looking forward to your call on Friday. And then from there, we're good to go.
All right, Dr. Sutton.
All right.
I'll